changing the water in balloon gastrostomy tubes, COVID-19 picture guidance. Please note this guidance is only valid through the COVID-19 emergency. Introduction. This picture guide has been produced in response to COVID-19. This guide has been produced following a review of current clinical guidelines and manufacturer's guidance. This guide aim is hopefully to encourage self-care for patients, carers and family members. Preparation. Step 1. Please wash your hands. Prepare a clean surface near the patient or yourself and wash your hands again. Step 2. Preparation of equipment. Your equipment you'll need is 2 times lower slip syringes, 5 ml or 10 ml depending on the prescribed volume of water for your balloon. The volume of water to be replaced, preferably sterile water. If not, on this occasion cool boiled water will do. Please draw up the volume of water to be replaced in your tune in one of your spare syringes as indicated in the picture to the side. Thank you. Step 3. Getting comfortable. If you are the patient, you can either sit in your chair or lie in your bed as long as you're at a 45-degree angle. Please place the equipment within easy reach, ensuring access to your gastrostomy tube and ensuring your site is clean. Clean around if required. Please wash your hands and then position yourself in a comfortable position with easy access to your gastrostomy tube and to your equipment. Preparation. Step 3. If you're a carer or family member, please position your patient or your relative in a comfortable position, either in the bed, the chair, at a minimum of 45-degree angles. Place equipment within easy reach and ensure your patient or relative's Gtube site is clean. Clean around this if required. And wash your hands. Step 4. Advancing your Gtube. Loosen the disc approximately 2 cm. To do this, please see the picture below. Take a note of the number that your disc sits above. In this case, it's 2 cm. Pop your fingers underneath the disc and just pull it back 2 cm. In this case, as the picture is below, to 4 cm. Then you advance the disc in a tube 2 cm into the stomach. This just means holding the tube at the point above the disc and just pushing it right till it's flat to the stomach. Step 5. Withdrawing the water. Hold your Gtube or your patient's or relative's Gtube in place during the procedure. Alternatively, you can loosely tape. Attach the empty syringe onto the inflation valve of the Gtube. This is the valve port that you don't use for feeding, and gently draw back the plunger of the syringe until no more fluid comes out, as demonstrated in the pictures below. Check the volume of fluid withdrawn and compare it with the recommended volume as advised for inflation, and please place the syringe down. Procedure. Step 6. Reinflate the balloon. Reinflate the balloon with the second filled syringe you prepared earlier. Just take the second syringe that you filled up, pop it onto the inflation valve which you previously took the water out, and slowly depress the plunger to put the water back into the balloon. Step 7. Returning your Gtube back to its original position. For this, you just simply pull back your patient's or your relative's Gtube to the original centimetre markings or till resistance fails. This just simply means taking your tube and pulling it back till you feel a wee bounce in the stomach. When you feel this, that's the balloon back to where it should be, and you simply just push the disc back to its original position as demonstrated in the pictures below. Now please wash your hands and dispose of all your rubbish. Checkpoint. If you're unable to remove any water from the balloon, check the balloon inflation valve is clean and try again. If you're unable to remove water, please contact your DN service. Also contact your DN service if the water you remove from the balloon is cloudy or any debris, and if the water removed is 1 ml less than the volume that you have previously inserted. Hope you find this guide helpful. Thank you for your time.